channel, and in succession to the videos what I have been taking up these days on NEET PG Entrance Exams 2024. So here are some of my very important MCQs from the notes from where I was preparing, and so these are the I'll be discussing about the very important one-liner MCQs from dental histology. So DADH, it's a very important part, and most there is round about 11 to 12 questions what can be asked from dental anatomy and dental histology. So do remember students, beginning with, so in this dental histology and histology, beginning with, so first line of the organs, in the first line of the organs you must have seen that the formation of primitive oral cavity. So the formation of primitive oral cavity begins at the age of formation of primitive oral cavity takes place at around 5 to 6 weeks of gestation. So do remember students, the formation of primitive oral cavity, it takes place at around 5 to 6 weeks of gestation. And moving on to the very important timelines. So students, do remember that it is about the 8th week of the intrauterine line, the vestibular lamina complex is being laid down. So this is a very important multiple choice question. The formation of primitive oral cavity starts at the age of 5 to 6 weeks of gestation, but at the 8th week of gestation we see that the vestibular lamina complex is being laid down. Now the formation of pulp tissue starts at about 8th week of the intrauterine line, the 8th week of intrauterine life. The temporomandibular joint is somewhat initiated at the age of about 10 weeks of the intrauterine life. Now the condyle begins to form roundabout at the 10th to 12th week of gestation, and the parotid gland is getting formed roundabout at about 4 to 6 weeks of gestation. Now the submandibular gland begins its formation by the age of 6 weeks of intrauterine life, and the capillaries and collagen begins to form at about 8 to 12 weeks. The sublingual glands begin to develop at around the 8 to 12 weeks of life. The masticatory mucosa, it starts developing by the age of 10 to 12 weeks of intrauterine life. The elastic fibers, they develop at the ages of around 17 to 20 weeks of intrauterine life, and the reticular fibers, they lay down by the ages of 6 to 8 weeks. Now the another very important multiple choice questions which is very important is that the tongue, the formation of tongue, it takes place at around the the formation of tongue in histology. What do we study? That the tongue develops from which of the following branchial arches. So in the multiple choice questions they can ask that tongue develops from the first, third and fourth branchial arches. So do remember students, the tongue develops from the first, third and fourth branchial arches. Next important MCQ is the primary palate. So the primary palate, it develops from the frontonasal process and the premaxilla, as well as the central, and the primary palate develops from the frontonasal process and it gives rise to the premaxilla, and in the primary palate the central and the lateral incisor teeth are there. Now moving on to the next important MCQ, that the formation of permanent teeth, very important. Students, do remember the formation of permanent teeth starts at the age of around 12 weeks of intrauterine life. So do remember students, 12 weeks corresponds to the 3 months of the intrauterine life. So the formation of permanent teeth, it starts at the age of around 12 weeks of intrauterine life. Now the next important MCQ is, that is, you must have studied in dental histology about the bud, cap, bell and the crown stages. So all the stages, whether it be the bud stage, the cap stage, the bell and the crown stage, growth and morphogenesis of teeth are regulated by a protein called as the sonic hedgehog gene. So students, do remember all the stages all the stages of growth and morphogenesis of tooth, whether it be the stages of growth of the tooth and the morphogenesis of teeth, they are regulated by the genes, by proteins called as the sonic hedgehog gene. All right. The next important MCQ is that hormone required for tooth eruption. Do remember, students, the hormone which is required for tooth eruption, it is the parathyroid hormone. All right. So do remember, in the multiple choice questions, they can ask you that which is the hormone which is responsible for tooth eruption. It is the parathyroid hormone. Moving on to the next important MCQ, the histological features such as the enamel knot, the enamel cord, and the enamel niche. The enamel niche or the niche, whatever you want to pronounce, the enamel knot, the enamel cord, and the enamel niche are all seen in what stage of tooth development? It is at the bell stage these structures are seen. So bud stage, cap stage, bell stage, and crown stage, that is the advanced bell stage. It is at the bell stages, at the bell stage, that the enamel knot, the enamel cord, and the enamel niche are seen in the bell stage. Now, next important MCQ where they very frequently asked, nowadays they are more focusing on the genes. So genes are, what genes are responsible for formation of what type of tooth? So patterning genes, the patterning genes for the tooth formation are the mesial segment gene, which is also called as the MSX, the distal segment gene, that is the DLX, and the BARX gene. So do remember, what are the patterning genes what are responsible for tooth formation are the mesial segment gene, which is called as the MSX, the distal segment genes, which is called as the DLX, and the BARX. So these are the three patterning genes for tooth formation. Now, moving on to the next important MCQs about the genes. So do remember, students, the molar teeth, the genes what are responsible for the formation of molar teeth are the BARX1 and the DLX1 and 2 gene. So do remember, the molars, they originate, their genes what are responsible for the formation of molars, for the patterning of molars, it is the BARX1 gene and the distal segment gene, that is the DLX gene 1 and 2. The next important MCQ is for the incisors. So for the incisors, they lie more anteriorly. So MSX1, MSX2 and ALX3 gene are responsible for the formation of molars, for the formation of incisors. The premolars, they form due to the presence of the mesial segment gene, that is the MSX1 gene, and the canines. So canines, they are formed due to the DLX1 or DLX2 genes. So students, these are all about the patterning genes for tooth formation. Oligodontia occurs because of mutation in the mesial segment 1 gene. So do students do remember, oligodontia occurs because of mutation in mesial segment 1 gene and the PAX9 gene. So do remember, the genes what are responsible for oligodontia is because of the mutation of the MSX1 gene and the PAX9 genes. This oligodontia is important. So oligodontia occurs because of mutation in the mesial segment 1 gene, that is MSX1 gene, and the PAX9 gene. Now, next important MCQ is the ectopic tooth formation is due to mutation in the LEF1 gene. So students, do remember, very, very important MCQ, that is the ectopic tooth eruption. When the tooth is going to be malposed in any of the places, it is an ectopic eruption. When it is abnormally placed out of its line of placement, when the tooth is placed aberrantly, it is having an ectopic eruption. So the ectopic tooth formation is due to mutation in the LEF1 gene. So LEF1 gene, it is responsible for ectopic tooth eruption, and all 4 layers of enamel organ are seen in the bell stage of tooth development. So students, this was a very short discussion about the dental histology, the top 10 MCQs top 15 MCQs, you can say. Top 15 MCQs of dental histology I have tried to discuss, and there is a possibility that you might get some of the MCQs, 1 or 2 MCQs in the NEET PG MDS Entrance Exams 2024 from this. Students, I would like to lay more stress upon that while discussing this, do remember that you should be mainly focusing upon the genes. So as I've told you, the LEF1 gene, which is responsible for ectopic tooth eruption, oligodontia occurs due to mutation in the mesial segment 1 gene. The genes, the patterning genes which are responsible for tooth formation are the MSX1, the DLX1, and the BARX genes. So students, if you the next upcoming videos, I'll be discussing more about more points, the remaining points for dental histology, the important remaining points for dental histology. Students and viewers, if you still have any queries or comments, you're most welcome to comment me in the comment section. And slowly and gradually, by the month of December or January, I'll be trying to cover up most of the topics what have been, which is of prime, the MCQs what are there from all the field, from all the subjects, whether it be the clinical or the non-clinical subjects, which are very frequently asked, the multiple choice questions which are very frequently asked in the NEET MDS exams 2024. So students, if you like this video, if you find this video helpful, give this video a thumbs up and share amongst your friends. Thank you for watching.